Have you been injured, gone to the doctor, had some imaging, and told that they can't find out what's wrong? Do you still hurt and not know why? There are some injuries that are commonly overlooked and or missed. And in this four-part series, we're discussing one of them, which is called facet joint injuries. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with facet joint injuries for decades. Now, this video series is not intended to be a replacement for sound medical advice, chiropractic advice, diagnosis, treatment recommendations, or even prognosis. Seeing the wrong doctor, however, can result in an incomplete diagnosis, the wrong treatment, and then failure to improve. In this four-part series, we're going to discuss number one, what is a normal facet joint? In part two of this series, we're going to discuss injury mechanisms. How does this occur? Part three, we're going to discuss treatment, and part four, we're going to discuss long-term recovery and long-term prognosis. So let's jump in. So in this video, we're going to discuss how is the spine injured, and we're going to discuss using injury mechanism called whiplash. Now, I call it an injury mechanism. I've already talked in some other videos about what whiplash is and is not, and so I'm just going to reiterate that for a moment. Whiplash is a mechanism. It's like saying sports injury. If I say sports injury, you have no idea if I had a concussion, if I'm talking about an ankle sprain, or if I'm talking about a dislocated foot, or if I'm talking about turf toe. So all it does is it tells us what environment the injury occurred in. That's what a sports injury is. Same thing with whiplash. Whiplash is an injury mechanism. Specifically, however, one of the whiplash mechanisms I'm going to discuss here is a motor vehicle crash. Now, the most common injury mechanism in a motor vehicle crash is an injury mechanism where the force is from behind. So using that mechanism, we're going to discuss this in some detail. When two vehicles have a collision, the vehicle from behind hits the vehicle ahead of it. The vehicle ahead of it, the seat typically acts as a catapult. The car moves forward, the seat lags, and then it springs forward. Now, this does something rather interesting to the spine, and I'm going to use a model right here. So this right here is a plastic model. This right here is the middle back. This is where you would expect the ribs to be coming off, and this right here is the neck. So this is the base of the skull. When the car seat slams forward, it compresses the spine. So then the middle spine starts to straighten. It then drives the spine vertical, upwards towards the head. And then the head starts to go from behind. Now, this is an abnormal range of motion. For example, if you right now are to bend your head forward and backwards, you will find that the motion begins at the neck and works its way down. In a rear impact motor vehicle crash, as the spine straightens, the rib cage and the middle spine, called the thoracic spine, starts to be rammed forward away from the lower neck. This creates movement that starts at the bottom and works its way up. It's completely reversed from what normal biological motion is. As this happens, there are some different changes that happen in the spine. For example, the normal curve, the normal forward curve in the spine is lost, and there is a reversal of curve that is seen. This reversal of curve is rather fast, nearly instantaneous, and creates a lot of different issues. So I'm going to use now a smaller model. If we take a look at this, these little bumps right here are the backside of the vertebrae that you can touch when you run your hands down. As the spine rams forward and the spine starts to move from the bottom up, oftentimes you can imagine these two parts will approximate or come together. This opens up the front of the disc, much like you would open up a book. It's not necessarily designed to work that way, so you can get tears within the disc, but that's another video series. As this compression goes up, you jam the joints on the backside of the spine. Last but not least, as the spine moves forward abnormally, even with the compression, these joints will crunch into each other. Sometimes the description is that these joints will chisel into each other. Now, what you can't always see on these joints, and this is another model, and so we're showing the gap right here. These joints have a gap in between. There's cartilage inside of those joints, not pictured on this one here, but pictured on this, that was the neck, this one's the low back. Right there's a picture of cartilage. Here is a healthy joint capsule. Here is a red, inflamed, injured joint capsule. So these joints will compress into each other. So you can damage the cartilage on the inside. These joints are alive. There's capillaries. You can get bleeding inside the joints. It's very difficult to see that on imaging. There are little tiny nerve endings inside the joints. These nerve endings can be compressed, bruised, crushed, damaged, and injured. In addition to that, you can even sometimes get fractures of the cartilage and then fractures into the bone. So these motor vehicle crashes can create internal damage on a small scale, but not minor, on a small scale that is difficult to be seen on current imaging modalities. And so you have to diagnose this oftentimes from understanding injury mechanisms, having the training for that, and also a very thorough exam. So as these bones ram forward, as these joints compress, and as there's tearing, all of these things result in this cluster of pain, and sometimes you get what we sometimes tell our patients is it's inflammatory soup. It's just there's this inflammation that's just bathing everything, and everything hurts. So those are the tissues that we know are damaged. We know this from doing what are called cadaver studies, where they look at people that had that died in motor vehicle crashes, but not from spine injuries. So they had what were called non-lethal spine injuries. So they may have died from internal bleeding or something else. So they study their bodies. We have human volunteer studies that have been done for years. And we also have lab studies where we take portions of the spine and we measure the forces that go through it. So over the years, there have been a lot of studies done looking at these issues. And this is all, for the most part, postgraduate training for any type of doctor, whether it's a medical doctor, an osteopath, or a doctor of chiropractic. So in closing, to wrap this up, about 50% or more, depending on the study you look at, of all persistent pain following a motor vehicle crash is coming from the facet joints, with another smaller percentage coming from the disc. So it's very important that this is evaluated at the beginning. And if you have seen a provider that has not fully evaluated you for facet joint injuries, you really should see somebody who can do that. So thank you for taking the time to watch this video. You have a lot to choose from, and I'm honored that you chose mine. Thank you, and have a blessed day.